Imagine gearing up for a great run or workout, feeling energized and ready to go. But then, just a few minutes in, you start struggling to catch your breath. It is frustrating, and it can really dampen your fitness goals, making you hesitant to stay active. The most effective way to help avoid exercise-induced breathing problems, often medically termed exercise-induced bronchoconstriction, is to consistently perform a proper warm-up before you begin any strenuous physical activity. When you engage in vigorous exercise, your airways can react to the rapid increase in air movement and the changes in temperature and humidity of the air you are breathing. A gradual warm-up effectively prepares your lungs and bronchial tubes, allowing them to adjust slowly to the increasing demands of physical exertion. This gentle, progressive increase in heart rate and breathing helps prevent the sudden narrowing and tightening of the airways that can often lead to uncomfortable symptoms like coughing, wheezing, and shortness of breath during exercise. A comprehensive warm-up should ideally last at least 5 to 10 minutes, and it should involve light to moderate intensity activities that mimic the exercise you are about to do. Think of it as a ramp-up for your body, not an instant sprint. For instance, if your main activity is running, start with a slow walk, then transition to a brisk walk, and gradually introduce a very light jog. For activities like swimming, begin with a few laps at a slower pace. If you are lifting weights, perform lighter sets with higher repetitions using good from before increasing to your working weight. Another crucial strategy, if recommended by your doctor, is to use your prescribed quick relief inhaler, sometimes called a rescue inhaler, about 15 to 20 minutes before your warm-up begins. This pre-treatment helps to open your airways and can provide significant protection throughout your entire exercise session. Additionally, try to choose exercise environments that are warmer and more humid when possible, as cold, dry air is a very common trigger for exercise-induced breathing issues. An interesting physiological response some individuals experience is the refractory period. After an initial episode of exercise-induced bronchoconstriction and following a short recovery period, often 30 to 90 minutes, many find they are less likely to experience symptoms again during a second exercise bout within a few hours. This is not a suggested strategy to induce an attack, but rather an observation demonstrating your body's complex adaptive capabilities. Furthermore, simply wearing a scarf or a specialized exercise mask over your mouth and nose in colder weather can dramatically warm and humidify the air you breathe before it reaches your lungs, significantly reducing airway irritation. By consistently integrating a thoughtful and gradual warm-up into your exercise routine, and by using any quick relief inhalers as specifically advised by your doctor, you are proactively giving your lungs the gentle and necessary preparation they requiring. This focused and preventative approach helps keep your airways calm and comfortably open, empowering you to fully enjoy your workouts and stay active without the constant worry of unexpected breathing difficulties.